Okay, we are going to start, but first of all we will open a lateral window just to see how the system is working. We want to see how the saline is releasing the Schneider membrane, and then we want to see how the bone graft is coming inside through the implant. In the middle we go like straight, making a strong pressure over the bone, and slowly. Okay. We will make a vertical incision for opening a good flap, which is not strictly necessary for DIVA Paltop, but we will do in this case in order to make the lateral window. Now with another instrument, kind of curette, we go again over the incision in order to be sure that we really cut all the periosteum. So we go again over all the incision. Now we start releasing the flap, and I start just scan very easily as before we did a good incision, like cutting all the periosteum. I usually use my tissue forceps on my left hand, but in order to make this video I'm trying to do it without it. Now we go with the releasing of the palatal soft tissue, and we have a good access to our bone ridge. We can see here the convexity of the sinus. Okay, so we will design our window with this shape, which is the same shape that we have on the X-ray. Little by little we can see the blue color. It means that we can see the Schneider membrane too. I make the polarization, and there, and I go very slowly, and I just press later with the drill until I feel here the floor of the sinus, so I'm 6 millimeters from the sinus floor. I remove my drill. I can now go, make it easy. Here I go with an ostetome because I don't want to cut the floor of the sinus. I want stability. So I try to just open a little bit with the ostetome. So I just cut the bone. I will press a little bit forward distal because I really don't want to be the implant too close. I make corrections, and I check that again I have the floor at 5 here in this second position. I use a second ostetome just to come inside. I see it's not easy because I need to make a bigger hole. So I make my hole a little bit bigger. I just want to open the cortical bone to allow my ostetome to come inside. Now my instrument is inside. I just make pressure and rotation, little by little, slowly, with time and love. So now I have like 5 millimeter. I think this is the for the sinus. I have the feeling that there is there a resistance. So I will produce now the fracture of the floor of the sinus. We can see the bubble of blood coming outside and inside. It means that our membrane is intact. We didn't perforate it. If you perforate it, you can see bubbles. So here we have the DIVA implant, 375-11.5. Okay. Hold the implant, which has its internal hexagon connection, and you can see there are like 2 holes, one each side, and where the saline and then later the bone will go out. It has a 3rd hole from the top, which now is blocked with a small screw. So once we place the implant and it's stable, we'll remove that screw. So then the saline and the bone will go out through the 3 holes. I come with the implant. I go in the hole. I know I need to place it like 5 millimeters. So it's about 1, 2, 3, 4, 5 throats. Insertion program. I make pressure and start placing the implant parallel to the bicuspid. Now I will remove, it's very stable, I will remove the screw inside the implant with a special screwdriver. So we make a screw with the small screwdriver. So here you can see the screwdriver that we just removed from the apex of the implant. Now you can see even, open, there is blood in the connection of the implant. I just put a little bit of saline and the blood came outside. This means that we are in the right direction. Now you can see even, open, there is blood in the connection of the implant. I just put a little bit of saline and the blood came outside. This means that we are in the right direction. We wash a little bit. We wash. We go out. Okay, so now we make a little more insertion. Another millimeter. We wash the saline. We repeat the procedure. And now we can see a bubble coming out from the implant. Again, we will repeat. We will wash. And then another turn. Now we can really see the bubble, and we can see the breathing of the patient. The patient is breathing, and you can see how the bubble is going in and out. If we tell the patient to breathe deeply, you will see what happened. Okay, the rhythm change. Okay, and the bubble becomes bigger. And we go with the last millimeter. This on place. You can see how the blood now is coming out from the window, and we put more saline. So the kit includes a curacin bone graft material, which is a paste. Come like this. So we will inject the material through the implant inside the sinus. You can see now the bone going to the tip of the needle. It's a plastic needle actually. So we start injecting through the implant the bone. Please pay attention to the window. Now we can see there is a movement in the membrane, and we can start seeing material. We can see biomaterial, who is now going out from the lateral window. Usually, the bone should go out from the implant, but as we have a hole there, it's coming down from the other area. So we guess it's everything filled inside, and we can stop placing more bone. We will keep this in case we need some more later. This is the final screw that will block the apex of the implant, and we will place it by hand. Okay, now I feel a stop, so we already placed the screw inside. It's very stable. Okay, so we are done with that. Now we are drilling for the second implant, which will be a standard implant, like parallel to the other one. I go slowly because I want to be guided by the mesial wall of the sinus. I will use the osteotomes in order to place the implant in the position between the cortical of the sinus and the root of the bicuspid. With the drill, I will open a little bit the cortical. Okay, I have a nice bone here that we'll use later. So we go now with the second osteotome. And we needed to go to the third. So this is a 3.75/13 Paltop implant. Just conventional implant. We take it, make sure it's inside, and we start to place the implant parallel to the previous one. It goes slowly, now it's getting more stability. I can see how the implant is going to the right position of the osteotomes. Okay. Now we are covering the implants. Now we are placing the second cover screw. Very easy with this key. We have the two implants placed, and we can see the bone is more outside now. We have here the cortical bone, and we replace it in the same position. So the case is done. We will suture and then make an X-ray to see the final result.